In a hair transplant, we're not creating new hair. What we're doing, in actual fact, is redistributing the hair from the back and sides of the scalp where the patient has too much of it into the areas of thinning on the top where there's too little. What's changed a lot over the years is the artistic as well as the technical developments in hair restoration. In the old days, clumps of hair were taken out and just put straight into the head. So they grew at an unnatural angle and they didn't look normal. Whereas now, by doing individual hair follicles one by one, we can transplant them following the angle and direction of the patient's own hair, and we just put the single hairs along the hairline here, and then the two hair follicles go in behind that, and then the larger hairs, the 3s and 4s, go in that. So you get this very nice transition, natural look to the hairline, which is obviously the key area.